Hi, my name is Rory Sun, and this is my project on understanding pathogenic organism contamination and sterilization. A pathogenic organism is a microorganism that causes disease in humans. The overall impact is leading to widespread illness and disease throughout the world, which I will give more examples later on. And the importance of contamination and sterilization is to prevent the spread of infections, diseases, especially in medical and healthcare settings. Moving on to Section 1, Pathogenic Organisms and Disease. A pathogen is a microorganism. Some examples would be bacteria, viruses, fungi, protozoa, and etc., which I'll talk more about in the next slide. Their role is to invade the human body, multiply, and disrupt normal physiological processes, which lead to illnesses. Their other role is to lead to widespread illnesses and disease, and some examples are the Spanish flu, COVID, measles, smallpox, and etc. And the overall disruption is that they interfere with normal bodily functions by attacking specific tissues or by releasing toxins, which can lead to symptoms like fever, pain, or inflammation. Moving on to some types of pathogenic organisms. The first one would be bacteria, which are prokaryotic organisms that reproduce rather quickly. An example would be E. coli, which causes food poisoning. Another one would be viruses, which are non-living entities that require a host cell to replicate, and some examples would be influenza, which causes flu, or HIV, which causes AIDS. Another example is fungi, which is a eukaryotic organism that infects the skin, lungs, and other organisms. For example, the Candida albicans, which causes thrush, or Aspergillus, which causes lung infections. And lastly, protozoa, which is a single-celled eukaryote that typically causes disease like malaria, such as Plasmodium. Moving on to Section 2, which is modes of contamination and transmission. The first mode of contamination is direct contact, which involves touching an infected person through shaking hands or touching open wounds, basically any physical touch. The next one is indirect contact, which involves touching a contaminated surface or object, such as your desks, the bathrooms, your phones, etc. A droplet transmission usually involves pathogens that spread through droplets from coughing or sneezing. And then airborne transmission involves pathogens that are inhaled and eventually leading to infection. And lastly, vector-borne transmissions involve insects like mosquitoes, ticks, or fleas that carry pathogens. And these are some preventive measures. The first one would be hygiene practices, which is basically just washing your hands, taking care of personal hygiene. And the next one is environmental sanitation, which involves cleaning and disinfecting any surfaces to possibly kill as much bacteria as you can. The next one is PPUs, which is the use of gloves, masks, and gowns to prevent any other sort of contamination in a medical or hospital setting. Vaccination includes the immunization to prevent viral or bacterial infections. And education, knowing the awareness and knowledge of transmission and prevention of diseases can help with the prevention of pathogens. Section 3, some sterilization methods. This is the overview. Sterilization is the process of eliminating all forms of life of pathogens. And the overall role is to prevent infection, especially in medical or laboratory settings. So this is the first method. The example would be heat sterilization, and an advantage is that it's very effective and reliable against pathogens. And an example would be a heat sterilizer, which is an autoclave. And some disadvantages would be not everything is suitable for heat sterilization, such as plastic materials, so they would be damaged. Moving on, the next method is chemical sterilization. Some advantages would be that it's suitable for heat-sensitive tools such as surgical instruments. And some disadvantages would be the chemical residues, which would take a longer process. Removing chemical residues that can remain on instruments may take a longer process. The next one is radiation sterilization, and the advantages would be effective for single-use medical uses and devices, and some examples would be syringes or even just Band-Aids. And the disadvantage is that it's expensive. And lastly, the last method of sterilization is filtration. The advantage would be it's useful for liquids and air, so without ruining any materials. And the disadvantage would be leading to specific or limited to specific materials, which means they can't sterilize all materials such as solids that are solid. And my overall summary and takeaway would be that understanding pathogens and how they contaminate and how to sterilize them is beneficial for maintaining public health and safety, especially in a medical or hospital setting. When applied in healthcare, the correct sterilization and contamination prevented practices can help reduce the risk of infections and protect patients from pathogens. And lastly, these were some of the sources that I used. And that's all. Thank you for watching.